Good morning.
Yeah, good morning.
Good morning, everyone. We do have a caller. If I could ask you to identify yourself just so that we can make sure we have it accurate on the attendance.
This is Michelle Hoskins.
Okay, perfect. Thanks, Michelle. Dr. Telfair, we have a total of 28 people on the call. Did we want to wait a couple more minutes or did we want to go ahead and get started?
Well, that's really up to you and Ms. Chrysler. But however, what we were going to get started with was just questions from the first session. And maybe while we're doing that, others can join and then we'll get started from there. Does that sound like a plan?
Yeah, that sounds like a plan to me.
Okay, Ms. Chrysler?
Yeah, good morning, everybody. I'm just going to underscore what Dr. Telfair and Rachel just said. So we'll start off with Q&A from session 1, and maybe a few more folks will join in. But I'm gonna just fall on my sword right now and say that because of everything scheduled on this Thursday and some critical things, I'm gonna drop off at 11. But I know that the rest of the Healthy Savannah team will be here if there's any Healthy Savannah questions to happen. Actually, Armand and I have to hop off kind of at the same time. So anyway, having said that, back to you, Dr. Telfair.
Okay, I am, as usual, doing a screen share. Can you see my screen? Okay, so where we're at now is I want to go over with anyone who may have questions that carries over. So first of all, thank you everyone for coming back to this session and coming and continuing to work with us for this one and the next couple ones we have. Second is that I wanted to go over any check-in questions that you might have from the first session, and then I want to go over a material or two before I get started with the actual materials. So do we have any outstanding questions, points of clarification, and so forth from the last session, or anything new that you thought of since the last time we spoke? I don't know if,
Looks like you did a great job, Dr. Telfair.
yeah, that looks like, it sounds that way. So it looks like that from the thing. So, okay. So then what I'm going to do, see if I can get the screen share, is I'm going to sort of progress to where we're going to start today. But before I get there, I will want to go over a few things before we get there. All right, so we're going to start today our session on the next discussions, which is related to how do you develop, then fit mission statements, goals, and objectives into your evaluation. And but before we go there, what I want to do is that we had some questions about assessment the last time around. I don't know if you see the thing that says Alabama CHIP survey. Do you see that one? Okay, so this is one set of questions. This is another set on a post-if then, and then it's an example. So what I want to do is I want to talk about this document that says the post-if then for you. So we had some questions about some of the things that y'all do as it relates to things like one-day training session, short interventions, and so forth. So this is an approach, a tool that was developed a good while ago, and by Dr. Umble, and developed and used, I should say, Dr. Umble, but it was developed actually by a number of persons, and it's a pretty strong approach to evaluating programs. So the idea is that many times you have programs that you conduct, like a training session or an education session and so forth, where you did not get the chance to do a pre-assessment. In other words, a pre-post assessment.
Hey, how are you?
Good. I'm sorry. Excuse me a second. Okay, so my apologies there. There was a gentleman who was looking for information and he literally walked into my office. So yes, that's never happened to any of y'all, right? Okay, so great. Anyway, so my apologies. Let me go back to what I was sharing with you. Let's see, I think it was this. Okay, so you should see this thing that says using the post-if then methodology. So as I was explaining it to you, you as have an opportunity to assess the efficacy of your work. The challenge of it is that you did not get a chance to do a pre-assessment, which is what a lot of good rigorous work says. However, you do have now a captive audience that you could use. So you have a number of choices. You could do the traditional pre and post, but a lot of times you may not be able to get a full assessment of people when they come in. So these are generally self-reported. But then you have this post-then method, which I spoke about before. And what that allows you to do is to assess based upon cognitive or just talking to people and having them to give, like you normally do in a normal conversation. You ask someone, what do you think when you came in? And then what do you think now that you've completed this session? So it is a pretty rigorous model, and I've given you some references. They're kind of older but goody references. There's more examples of this in the literature, but I thought it would be good. So it's called a post if then, or a retrospective pre-test, then post-test pre, whatever way you want to design it. You all who write these sections, you do a lot of community training, you do a lot of community assessment. You include these in your health assessment programs, your social service programs. You include these in the grants and applications that you have. So in one of the vexing things a lot of times is that a funder or a government agency may say to you, tell us how you're going to know whether or not people really gain anything from what you did. And you may not, because of reasons, be it budget or other, be able to get a pre-test. So this is the design that's used to do this. And so if you look at table 1 in the handout, this is a handout you all should have gotten this morning. What it shows you is that it gives you a bit of a background on how this tool is used in the literature. I apologize for not having updated this with more recent references besides the 2000 references, but there's a number of other references in terms of how it's used. But what we did is that we want to show you how it's looked at in terms of things, measuring things like knowledge, skills, efficacy, attitudes, and behavior, which are pretty much covers 90% of what we do. So this tool allows you to cover those areas, and it gives you some background for that. And then I give you some examples based upon the columns, the knowledge areas, skills areas, efficacy, and so forth. So I've given you those in the handout itself. And then I've given you some concrete ways to look at this. And so what I want to do though, because it's in the tool here, but I want to show you on this one. So how it works is essentially, if you say you are conducting a skills development workshop like you all do with Health Savannah, and you really want to get an assessment based upon, say, a scale, which is the highly recommended way of assessing people, and you want them to assess things from like 1 to 10, 1 to whatever, and low to high. And so they can tell you based upon when they walked in the door what they thought their skill level was for a particular area of skills, say, understanding how to, conduct the evaluation. And then once it's over, you can ask them, now that you've participated in that effort, and now that you've learned these things, how would you now rate your skill level? And then you get a chance to do that afterwards. So, and you could do this in person, or you can do this on the web. And for example, with a Qualtrics assessment, you can do that. So you say you have a 4-week program like we do, and we assessed you. If we asked you to keep in mind what you've learned and what you haven't learned. And then what we do is at the end of the 4 weeks, we send you something that says assessed your knowledge based on when you first started this thing 4 weeks ago, and then how do you feel now? And then you can show how that's done. And then the way that you who are learning how to do this, you can assess the difference between what their skill level, what their average skill level was, which is their mean level here, and then what they've learned. And then you could do, a simple t-test, or dual variable analyses, and then we'll tell you whether or not what they've learned was significant or not based on a very simple statistical test. So, it's a little more than you may want to do, but one of the things is adds high degree of legitimacy to this. And I can tell you that we've done this off and on, and other people who run these kind of assessments will tell you that this way of assessing is as efficacious as doing a traditional pre and post. So a lot of times you don't have the resources to pre and post, and you don't have the statistical approach to this, but a simple analyses of this. So if you don't have statistical software, you could use something like Excel, which could do a simple t-test for you, or some other, which is Excel, which is your Microsoft package that comes with that. You could do that as well. So that's another way to do that. And so what we do is we kind of, I'm showing you these items on how you can conduct the work. We walk you through here, give you some concrete examples, how you might want to use this based upon the work that you do. And then a lot of times in your assessment, or at least in the grading that you're doing, you need a rationale for why this is good or not good. So what I did is I excerpted from a very, very very reputable article the reasons why you would do this. And these are kind of the 4 main reasons why you would do that. You could basically just takes the text. I just did a quick edit of the text. And these are just sort of the summaries of those, and that I've excerpted from that. These are not quotes, but they are paraphrases of the rationale. And I've given you 4 different ways that you could work with that. So I would just say that, you all who are doing this work, here's a lot of the references. There's some updated ones you could also look at. But if you're doing this work, you may want to take advantage of this for this, because this allows you to use a very rigorous method to assess gains in the things that we said: knowledge, skills, attitudes, beliefs, and behaviors based upon personal assessment. That is the only caveat I have, is that these are people making assessments about themselves. So if you wanted to add more rigor, you'd have to do observations or some other kind of add-on testing, like a knowledge test or a skills test, something like that. However, if you wanted people to get this knowledge. Now, the reason why before I go on to my more concrete examples to show you how we've used it in the past, the reason why I think it's important to consider how this is done is that if you're putting together an assessment of an effort that you've made, it's not enough for you to simply ask people, the usual sort of post event questions like, how is the room? How is all the kinds of things? What you really want to know is what they actually gained. That's what you want to know. And that's what whomever is supporting you want to know, is what were the gains? What were the gains in knowledge, skills, how people feel about, what they've learned, their attitudes, their beliefs, and so forth. So it is important, I would suggest, that whenever you do your work, that you consider to have some level of assessment, and that the other part of that is that it is doable. Even if you have limitations in your methodology, there are these very effective and very rigorous ways to work with your limitations. And so that if there's one lesson to take away from this before I give you concrete examples, is that if you encounter an opportunity and you need to have an assessment, and you do a pre-evaluation and you figure that whatever you're doing is not valuable at that time, take a step back and see, are there alternative methodologies, alternative tools you could use, and that sort of thing to work with this. And that's kind of how we actually came upon this tool itself, because we hit a brick wall in figuring out, we did a lot of health fairs, and we hit a brick wall on how to assess that, because health fairs are such that you don't know who's going to come in. You can catch people leaving, but you can't necessarily catch them coming in. So we are able to do this. Okay, so having said that, then I'm going to leave this. This is we sent you this. You have a copy of this already. And let me go to sharing with you another screen. So you should be able to see something called Magic City Stroke Prevention Health Fair. Yes? Cool. All right. So I'm going to enlarge this so you can actually see it better. All right. So this is a project that we did when we were in in Alabama. And we were in Birmingham, Alabama, thus the name Magic City, which Birmingham, Alabama calls itself. So if you were in Savannah, whatever euphemism y'all use for Savannah, you or in the area, you could do that. So what it is that we were doing work, and this was a federally funded stroke project. And so one of the elements that we did was a community outreach and a community training and community education around this. And this was a health fair that we did, which I know y'all do a lot of these, and you work with a whole coalition of people to put together a health fair. And the way we structured the health fair, if you will, was in a horseshoe-shaped arena. So basically, you came in one entrance and you went around to all the exhibits and everything, and you exited another arena. And so that allowed us then to get some information from people when they walk in, and then just on who they were and who they represented and so forth, registration and all that kind of thing. And then they went around and they were spoken to, they gathered information about, and so on and so forth, related to the stroke prevention project that we will. And as you know, one of the things about stroke, diabetes, cardiovascular disease, and so forth, we live in an area where these things are endemic, and we have high rates of that. So this was something that we wanted to be able to start with this. So at the start of the effort, we had this health fair. So we then needed to have some kind of assessment that we could give feedback to ourselves in the project, as well as our community partners related to that. So we collectively put together this evaluation. It's really was a form and a tool that we were using. So the first part of it, of course, was your usual types of information that we made it in very plain language. People could easily do the tick box. You could see that. So if you go from left to right, you could see we had the questions there, and then we had them do the tick box based upon their, four-point assessment. As I said, I strongly believe that you should ask people's questions as best you can in a range, as opposed to just simply yes and no, even though sometimes we have that. Then, based upon, the health checks, we had the 4 areas in which we were funded to pay attention to: anemia, BMI, blood pressure, vision, and so forth. These are all, as you know, risk factors that needs to be watched for stroke. And we didn't ask people's age or anything like that. For the most part, in the beginning, we did sort of get that as they were more comfortable asking our questions. And so what we did is we wanted to just ask the questions. As I said to you before in the last one, we try to ask questions that you really need to know. So this is a really need to know survey. And it wasn't everything we need to know, because we would like a few more things, but our partners really felt strongly that we needed to have a tear sheet type of approach, and we also need to have a cut to the chase types of questions. So the BMI and all those were risk factors. So we had our general assessment of a level of comfort, cultural accessibility, and that sort of thing from persons. We had then our risk factors approach to this, and then we went into our knowledge and attitudes and beliefs part. And so we asked that amazingly in 3 questions. This was one of our brilliant colleagues who was very good at marketing, gave us these questions we have. Then us, who the evaluators, we wanted to ask core questions. So we had these 6 core questions, and we had majority of trainings that people encounter on these 6 core questions. And so how we did that, even though in the later version of this is the earlier version, we used the pilot part. And in the later version, we asked people to rate, like we showed you in the other one. You saw what the other one you saw was actually, and I'm going to show you that in a second, was how people rated it. So anyway, this was a quick way to get pre and post at the same time. So we can ask people, based upon this, do they have awareness of, before and after? So before today's health fair, how aware were they, and so on and so forth. And then after, how aware were they? So we got their age, we got their race ethnicity, and then their gender. All of these things are key variables we needed to assess. And of course, if people had time, which, as you know, health fairs isn't always the case, but hey, we asked anyway if people had comments. That's always a good thing. And people actually did, believe it or not. It always surprises me that while we're pretty cynical that people are not going to give you some kind of written response. Actually, we got about 50% of the people that we got completed the form also gave us a response from a 3-word to a paragraph. Some people did, and because some people were very, very grateful we had to hit the fair in the first place. So this is an example of a tool that you could use and that you could develop. Very simple, very easy. I mean, it literally took 5 minutes for people to complete, but it gives you some really core data, and you can analyze it the way that I showed y'all from the other thing. All right. So I'm gonna show you one more thing, and then I'll entertain questions. All right. So can you see the Alabama CHIP survey question bank? Cool. All right, then. So this was another survey we did. CHIP, as you know, is a Child Health Improvement Program. And this is something we did with the state of Alabama. We did this also in North Carolina. And I couldn't find my North Carolina one, so I have to go to my Alabama one. But anyway, this is another way that you can get pre and post from this. And this was a group here. And so this is where we adapted actually a survey, an existing survey, to what it is that we were trying to do. So the first part of the survey itself really was trying to get at parents' assessment of their child's health. And this was the question that we had, is that they were now participants in the program for health, because this was when we first introduced CHIP, and we were, or year after year, the Child Health Program, or the Child Health Insurance Program. And what we wanted to know is that for those who participated in it, what do they think? So we were able to, because we didn't know or meet them when they first enrolled, we did ask them to assess whether or not access, which is this question here, access to a doctor or a nurse, or some other health provider before they had insurance, what was the ease of that when their child was sick, and well, checkups, which are all the things on which the CHIP was supposed to address, and then the CHAPS, which is the adolescent version of that. What were the programs on this one? And then we did the survey here. Now it looks like a long survey, but actually, if you follow the survey itself and you look at the questions itself, we will, see that a lot of these things are very, very easy to answer, and there's a lot of before and after, post, if then type of things. And these are all in front of you. I'm going a little bit here because I wanted to get to attitude and belief, but also in behavior and emotional states. And again, these are point by point. So with the child insurance program, what we were very interested in was whether or not families who normally did not have access to different types of health services, did they receive these health services based on the assistance provided to them by the ease of access, because now they had both support persons in place and people paying for them and an insurance program in place. And remember, these are early days before this. This was like what the Obamacare people used, type of surveys the Obamacare people used to develop what they did. So a lot of that was there. All right, so we did behavioral health, and then we did emergency care room. And these were independent of whether or not the child had an acute or a chronic condition there. And so we were able to capture that information in another way. Then we had dental care, and then we had vision and prescription medicine, and then a general health assessment that you all have seen over and over again, the 8-point assessment scale. We had those there, and they were, so the self-assessment work that. And then we had access to care questions on this one in terms of just the general access, in terms of their perception, their history, and then of course, because Alabama, Department of Health was very interested in making sure that they were hitting the target group that they were supposed to target. We had these last questions here. This is all in the handout to you, and I wanted to kind of get those. And so this is the enrollees questionnaire that we provided. And then we did this in multiple places. We did this in person. We did this by mail. And this was, we also did this via an online, early days online assessment. And we did that work. So the example here that I wanted y'all to pay attention to and see was how best can you use this post-if-then assessment. And here are some examples of that. So questions and comments?
Dr. Telfair, are there any places, so it was knowledge, skills, attitude, behavior, is there any place that you wouldn't, very specifically, would not want to do this?
Well, that's one of those questions that have to do, so the thing that you want, you want to, these are population level assessments, okay? And they're based upon either individual comments, whatever, the population level assessment. So if you had an acute situation where this was very nuanced to a person or nuanced to a family, this is not, you would not do this. You would try to stick to a more conventional assessment tool on that. However, this is for programs that are and services that are trying to just get a sense of the meeting their goals and objectives based upon some assessment. And if you've noticed, the pre and post if then were all linked to the delivery, the existence of a program and the delivery of service of that program. And so they were all being able to answer questions related to objectives and so forth. So if it's a nuanced, very narrow situation, I would say use your best judgment on that. However, probably for the most part, you should use a conventional tool. So for example, if you're trying to assess anxiety and depression in an individual, then you should use a standardized anxiety and depression psychometric tool, right? If you are trying to assess whether what a funder, or a person in a political situation thinks about the work that you do, then you might want to use a open-ended type of questionnaire or some other kind of very targeted tool for that. So these are used for that. So for the most part, 75 to 80% of what you do, you can use this approach. The other more nuanced bit or focused bit, you would want to be a little bit more circumspect and use something else for that. Does that answer your question?
Yes, thank you very much. Appreciate
No
it.
problem. Okay. Other comments or questions on the use of tools like this?
I have a question.
Sure.
And I've wondered this in the past. You know how you had the scale of 1 to 10?
Mm-hmm.
So low to high,
Mm-hmm.
excellent. And how do you divide up what's acceptable grading and what's not? Because
Yeah.
I noticed I've taken surveys in the past, and I'm one of those people who don't necessarily give a 10 because nothing is perfect, even though I'm satisfied with whatever it was. And then they want to know why they didn't get a 10, but I gave you a 9. Or, is a 5 really an F? So how do you come up with what's acceptable ratings or not even acceptable? You just want to know what do people really think if they gave you a 5.
Right. As opposed to say a 6 or a 7. I get it.
Yes.
Yeah. So in the realm of a survey and testing, generally before those are put together, there is decisions that are made in terms of what would be acceptable ranges. Okay. So that's the first thing they do. And that is based upon, if it's a tool that has existed for a while, it's probably based upon previous assessments, and they're using averages, running averages or historical averages and so forth. And so they know, based upon previous administration of this tool, what is an acceptable range that tells them something about that, because it's their need to know how people felt. So first of all, second of all, it really has to do with the administrators, themselves. If it's a marketing group, then a marketing group, they have a tendency to have less science in their neck of the woods. They're really just looking for a majority of people who lean in a mostly liked versus mostly disliked situation. So they're dividing it up, not so much down the middle, but more they're looking for the margins, left or the right. So when you say you give a 9 and not a 10, then those are the kind of people that will want to know. For them, there is not a really big difference between a 9. I mean, there's a big difference between a 9. A 10 is perfect, and a 1 is not. And they want to know the why isn't what was done perfect marketing. But a researcher, for the most part, is looking for a range. So for them, a 10-point scale, 7 to 10, or 8 to 10 is the range. That's would be a high score. In between, would be moderate and then low. So they're using statistical averaging to get at that. So their assessment of that is different. And the statistical averaging is mostly based upon a population assessment. In other words, they've done it before. They have used this scale other ways. They're also going to use the analyses and not on a single item. They're going to use it on multiple items. And they're going to do some analyses that allows them to look at multiple items at the same time. So I would just say the answer is, and then there's other different reasons, but let's just say we're applying it to you and you're developing a scale. The highly recommendation is not to use a single item to assess what it is you're looking at. Use multiple items that are relevant to that, and then use a means by which it's a real scale, where it's a multi-item scale and you're doing the averaging across items in the scale. So it's a little bit more, I have a little bit more to this because I do a whole training on this, but I'm trying to condense the answer because it's much longer, as you probably figured out, than what I'm saying. But the simple answer is look to see who's asking you the question, because the response you get is based upon what they're looking for. Marketers have a tendency to want you to put on all on one side or all on the other side, because they're really not paying attention to people in the middle per se. Researchers have a tendency to be more of a mean and median type of people, and they want to be able to see kind of where people fall. And then, the other third major category, of course, is diagnostic. So if you are, say in a behavioral situation, mental health situation, and they want to get a sense from you, like, for example, the CDSD, which is the CDC depression scale, and then the CDSA, which is their anxiety scale, and so forth. What they want to do is there's a range that they know the population in general gives that says, while you're leaning in the direction of being an anxious person, or leaning in the direction of a depressed person, and then they want to do a follow-up with you to do something a little bit more nuanced than that. So those are the three main areas. But you applying it to your work, you would have to make a decision about what you think is a reasonable range, and then based on a reasonable range, you could do high, moderate, and low. But I would just say talk to whomever your assessment person is, or use your best judgment if you're a trained person on that part. I'm sorry for the long answer, but this is not a short answer question. Okay, Ms. Park? Your hand was up?
Hey, good morning, everyone.
Morning.
So I may have missed it in the answer. But my question was, their preference or difference from a research perspective in using a scale like 1 to 5 versus a scale that's 1 to 10?
Well, okay, so I didn't catch 100% of what you said because you had a little glitch there. But I think what you're asking is that the whole question of how do you put together a Likert scale, if you will, and make a decision on that. Well, that is based upon a couple things. So it's just good testing and based upon experience. So some scales themselves will start off, you as a researcher, you decide on what you think the range will be, and then you pilot test it to see what kind of response you get. And sometimes the 5-point scale works well. Sometimes you need to stretch it out. And it also depends on the testing that has been done previously, because what you're doing is that you go from administering the assessment to analyzing it based on statistical data. And your statistical data is the one that tells you if your range is broad enough or not, and if you have that. Because what you're looking for is you're looking for demarcation across the range, right? You're looking for separation between items. And if things are too clustered in one direction or another, then you're concerned about that. If they're too spread out, you're concerned about that. So you have to do multiple testing. And through multiple testing, you come up with what the range is. And that's why you see different tools have different ranges, first of all, in terms of that. And it also depends on whether you're assessing skills, knowledge, behavior, and so forth. That's the other consideration, is that. So you have to make a decision based upon what you're actually assessing and then how you want to get at that information. And skills test has a tendency to have, as you probably noticed, longer ranges. They'll go from like 1 to 7, 1 to 10. Behavioral ones will be shorter. They'll be like 1 to 5, that sort of thing. Knowledge will be shorter. And that has a lot to do with assumptions. There's called, a psychometric theory, which is behind assumptions related to assessment and what you're focusing on. Again, longer discussion. And if you email me, I'll send you a really good summary. I'll send you a good talk that we have. You can have my whole training on this. You're welcome to it. And
That's
that
really
will
helpful.
explain a lot of the answers. How it goes you from explaining psychometric theory to actual how you come up and make decisions that you, Ms. Barlow asked me about how you put a scale together. Does that answer your question?
Yes, sir. Thank you so much. Very
No
helpful.
problem. Okay, other questions before we get started?
Dr. Telfair,
Yes, ma'am.
Vera put in the chat that she didn't, I don't see it either. The examples that you had, were they sent separate from the packet that Rachel sent out?
They were sent, I think, this morning, Miss Rachel.
Oh,
Yeah,
okay.
so there
No,
were
I missed
3
that.
reminders
Okay.
and there's 8, 9, and 11 documents because we added to it as we sent it out. So in the last reminder is where all of the handouts and everything are, but I will resend that as a follow-up once I send out the link to the recording as well.
Okay, if it was sent this morning, I missed it. Okay.
I don't see the health one in that email. Maybe I'm missing it. The one that was labeled fair. Am I
You
missing
mean-
that? Is anybody?
The health
I'm
fair,
missing
you
it.
mean the Magic City Health Fair?
Yeah.
Okay.
might be
So I
missing it.
will,
went-
Yeah, I will, that should have been in the packet, but I will definitely resend it to Miss Rachel so that she could, I'll make a note to myself to resend it to Miss Rachel so she could send that out again. Okay,
Okay, appreciate it. Thank you.
no problem. All right, any other comments or questions? Requests? Okay, then, so, okay,
Dr.
so,
Telfair,
Miss-
I don't know if you know, but we have I have at least been enjoying a really nice nature slide screen while we've been having these Q&As. So I'm not sure if you know that or not.
no, okay, yeah, no, the Q&A was, it wasn't meant to, that was just for us to discuss. So my
Sure.
question now is, do you see the essential skills monitoring one?
Not yet.
No. All right.
Now I see it.
Okay. Okay, do you see it now still?
So but it's the 2 slide, the next slide and the current slide. The one
Yeah.
how you did it before was just the full slide of.
Yeah,
Of the
okay,
first.
let me correct that. All right. Okay, what about? All right, crashed on me. Sorry about that. Okay, what
Fair.
about now?
Yes, that's good.
Okay, all right. Okay, so let's get started with this one. And we will probably just get into a little bit because it's going. I know, Ms. Chrysler, you and one of your team members have to leave shortly, but we'll get started and then we'll catch up. So, all right. Okay, so what we want to talk about now is the incorporation of your of the evaluation into your mission, your your goals and your objectives on this one. So just as a reminder, and this comes back from the planning, if you recall from the planning training that we did last time around, we had to show you what the connection is between your mission statement, your goals, and the objectives of whatever your program plan is going to be. Now, if you, like me, some of you have said that you don't necessarily have a program, you have a service. Well, it's just think of it the same thing. And that the service itself is part of a larger effort. And the larger effort is your program. So you have a foundation for your program planning, which there you have the direction that you want to go, and then how you want to assess this. So your direction or your foundation is going to be your mission statement. The direction you want to go is going to be the goals that you have. And of course, how you want to assess are going to be linked to the objectives that you have. So just as a reminder, then your mission statement should have pretty clearly an overview of whatever your program aims are going to be. What is it that your purpose for existing is going to be? And as I've said multiple times through all these trainings, it should reflect the philosophy of your program. In other words, why it is that you do what you do. And what is the rationale for it, but also what motivates you, what keeps you going, what gets you up every morning to do what you need to do. And then your goals and objectives are going to be linked to aspects of this. Now, goals and objectives, keep in mind, and this is something that we talk about sometimes we don't, are going to change depending on what kind of effort or program you have. So the first three bullets are going to probably stay the same for the most part, you know, for that. So if you have a program that is in place, for example, your United Way, well, the United Way, for the most part, the first three bullets are what you're going to have. However, if United Way, you are constantly having new programs and services and other things that come about. And so that means goals and objectives are going to be, you know, there, and then for as long as that program or that effort exists, and then it won't be there when it won't. And so keep that in mind. And I think that gets lost in translation sometimes, is that you will have goals and objectives, and you will translate those or transfer those to other different programs, but they will change because the nature of what it is you're trying to do is going to change. The other thing to keep in mind, and it's really, really important for y'all, because you work in a community, mostly a community-based environment, the one constant about that environment is that it changes. And those changes are a lot of what you should be focusing on when we're talking about monitoring and evaluation. Because one of the things you want to do, as we have said before, is to constantly do a self-reflection, you know, and see, do we need to keep this effort or this program or not? And also for systems change, which we talked about in our last training, it's really important that if you're going to do systems change, you need to do honest assessment of what you have, what you and where you want to go. So the whole, you know, keep, you know, toss or change effort. And then, like I said, don't confuse your mission statement with your vision statement, you know, because your vision statement is linked mostly to your philosophy, where you want to go. Your mission statement is linked mostly to what you want to do. You know, how do you approach this? So your vision statement and your philosophy are going to be, how do we look at this? How do we approach this? But your mission statement is going to be what you do. So that should be a review for that. So here's a couple mission statements that are linked to clear assessment that I thought would be helpful to understand. So the mission of the Walk-Up Health Promotion Program is to provide a wide variety of primary prevention activities for residents. And this is in the community setting. So what about in the healthcare setting? Well, take the same program or idea, and then the program is aimed at helping patients and their families to understand and cope with physical and emotional changes or social recovery from, say, cancer surgery. And that's so that would be the mission statement for those programs. Now, goals, as you all know, and many of you, this is a refresher. So forgive me if you know, for kind of laying this, but just to be clear. So goals are less specific than objectives, and we said this before. And what they really are used for is to reinforce what you just put together in terms of your mission statement. So again, the mission statement is a statement of what it is that you plan to do and how you plan to do that. And the vision statement is the philosophy or the reason why you do what you do. Okay, so the goal is linked mostly to your mission statement. And so that means that the goal itself could be, broad or narrow, depending on what it is your program is going to have. So the expectation of your goal has to do with these things here, which is that it's more global. It includes all your programs, not just the one service, but multiple services that you might have. So I recommend to many of you, for every program, you have no more than 2 goals. I know people have more than that. And I know sometimes they will substitute or have goals that are really either objectives or tasks, but keep that in mind. It covers all your programs. It is more general. It takes a longer time to complete because, it's there. And like, the mission statement, it doesn't really have a deadline per se, because it really does depend on how long you have in place that either program or set of services that you want to do. And it's often not exactly measured. So a lot of times it's a perception. Your goal is a perception statement. You make a judgment about whether or not you're meeting your goal or not. Some other times, though, it is very measurable. It is whether are we accomplishing these things or not. We recommend very strongly that whatever goal statements you have, that you try to do some level of measurement in those statements that allows you then to have a sense of where you're going and what it is that you're trying to do. So keep that in mind. And this is a few examples of, I think, they're general but measurable goals. Like, for example, spread of HIV to prevent that youth in Indiana, reduce incidence of influenza in residents Delaware County, incidence of cardiovascular disease of Smith in the Smith, employees of the Smith Company. These are all very clear goals that are linked to mission, that are linked to things that are very measurable and very concrete. So the other thing I want to go over before we take a morning break is just objectives. Now, you all have had, probably many of you in leadership have had training on objectives. So this is not new to you, but I want to try to introduce a few new things that you may not have heard, or just get you to rethink it. So keep in mind that the objectives may be reviewed for some, so kind of bear with me on this. So it's more precise than goals. It represents the steps, the actual task, the work you're going to do. But it's more than that. It is sort of like when you say, here's our goal, and then you say, here's the objectives that will allow us to achieve our goal. So in the language that you normally have in whatever document you have, you will say, here's our goals or our aims, and then here are the objectives, which are the tasks and things we're going to do that allow us to accomplish our goals or our aims. And so it's very specific because it outlines what it is you're trying to do. It's measurable, and it's generally several layers. So again, we recommend no more than 3 objectives. And a lot of times, like what I mentioned before, when in the planning that we did, when we come in, as I said, get on the train while it's moving, we're asked to then take an assessment of the goals and objectives of a person's program. And a lot of times, most of the time, I should say, we will then do a review of what the objectives are. And many of the times what we will do is we will make recommendations to modify those goals. Those objectives. Many times it is to combine them, to eliminate them because they're redundant, or revise or come up with a new objective that is more in line with what it is you want to do for the goal. So one of the things that you should do in any kind of monitoring evaluation situation is that once you've written all the other aspects or all the other elements of your proposal, of your planning, you go back and you do a really good look at your goals and aims and see whether or not what it is you plan to do lines up with that. Now, the other thing to keep in mind, which we've said before, but I'll say it again, is that many times opportunities will present themselves. There'll be a funding opportunity or a partnership opportunity or something like that. The question that you really should also ask, besides whether or not you can benefit from this, is that does this opportunity align with our mission and our vision and our philosophy? Because a lot of times what's going to carry you through is going to be that work. And so it is important for you to do that. And one of the real reasons, besides the fact that it allows you and the people you work with, particularly for leadership, to stay on task and target, is that the ability to express and to explain these things to the people you're serving lines up much better if they're congruent with your mission and your vision and your philosophy, and to be able to do that. That is a decision that you, as a community leader, will need to make. We just recommend that you do consider that as your list of considerations when an opportunity presents itself. There are going to be many reasons to take it, but one of the ones that we strongly recommend you do is to see how well it lines up with your intent, right? Remember, what we said before is that the vision and the mission and the philosophy of pretty much of your agency, no matter if it's a government agency or if it's a CBO, NGO, or a personal, those will be consistent for years and years and years to come. What will change is the things below that, which are the goals and objectives and the programs. So keep that in mind. All right, so Ms. Rachel, what I want to do now is take a 10-minute break for people and then come back. So we will finish this section and then we will finish the rest as we go, okay?
Hi, I'm Patrick, and Miss
Yes,
Rachel
sir.
stepped out of the office for a second, so I'm co-hosting. So that's a good time right now.
Okay, then. All right. If you go ahead and do that, I know we're going to have some people who are signing off, but we'll go from there. So if everyone could come back, what is our time
It's 11
here?
o'clock right now.
Yeah, it's 11 o'clock. Perfect. So 11:10. Come back at 11:10. Perfect. Then we'll do that. All right. See you, Ms. Chrysler, and I think your other gentleman is that Mr. Turner? You and Mr. Turner have to leave? Okay.
Patrick.
Patrick. Oh, okay.
Yes.
All right.
No, yeah, Armand will probably leave after me. I've got one thing before the thing that we've got to do together. So anyway,
Understood. All right.
Yeah.
Okay.
Thank
All
all
right.
right. Appreciate
All
it.
right. So 10 minutes. Okay, 10 minutes for the rest of y'all. We'll be back. Thank you.
Right.
Mr. Hubbard, thank you for your help.
You're welcome.
Already have it.
So Mr. Hubbard, are we ready to come back?
Yes, sir.
All right. Okay. Okay, so we'll go ahead and hopefully people are back and we'll go ahead and get started. So this is the next, what we had before is we covered objectives. So we're gonna continue with our discussion. So hopefully this will give you a little bit more information about objectives that are critical to understanding how they fit together with the process. So as I said before, you have the three main stages of your effort or program. And then you have those that are that will change as your program progresses, moves on, entertains other opportunities and the like. So I want to give you a sense, and this is something that you as a leader and as someone who is discussing with your assessment team how you want to approach this. So different levels of objectives is just talking about that. So I want to kind of give you an overview of the type of assessment that are linked to your decisions related to what objectives you're focusing on. So the first, for example, the first row, you see that the type of objective you may have may be a process or an administrative objective. Some administrative objective, like what it is that you want to do in terms of the persons you want to serve, people you want to hire, population you want to make sure that you include in your work. And the outcome are going to be assessment of the activities and the tasks. In other words, the performance that you have for that. And so the best type of evaluation for that is going to be process evaluation. And we've already gone over the type of evaluation in the previous slides. The other part is, for example, another type would be, say, learning. You all do a lot of training, education programs, and so forth. So what you really want to know is you want to know, did you sort of change attitude, skills, and I would add practices to that as well, to that. So if you are taking notes, I would say attitude, skills, and practice is what you want to look at in terms of your outcomes. And of course, the long term is impact. In the interim, you're going to look at outcomes, but in the long term, you want to look at impact. So your evaluation is going to be impact assessment, because what you want to know is whatever point in time you are looking at this work, you want to do an impact assessment. So remember, we said that impact assessment generally happens after a 3-year or 5-year period, and you assess that. And of course, you're going to be looking at outcomes in the interim, but really what you want to know is at the end of the day, did we accomplish and what we programmed, to what degree we accomplished it, and did we have the influence on that one? Same with behavioral change. And then the other type of thing is outcomes. So this is where you all, particularly who work in health and mental health, and behavioral health, or other types, or even education, is changing quality of life. For example, health status, risk assessment, work, social benefits, so forth. So these are the things where you really want to look at that. And so you're looking at an outcome assessment. So that could be a year-to-year, it could be a quarterly, biannual, and so forth. So the type of evaluation you're going to have is going to be a little bit more focused. Is going to look at more of the work and the results of that work, really results-oriented, task-oriented type of thing. So the objectives that you put together are going to be linked to the type of intent, type of program, type of service, type of effort. And I give you a range of ways to look at this and to think about that, because I wanted to broaden you. Generally, when we talk about objectives, we just kind of walk you through, this is an objective, SMART objectives, and so forth. I'm going to do that, but I wanted to first introduce you to a way of thinking about how you might put an objective together. And so as we go along, keep this in mind, that it is not only important to understand, that you need to have objectives and understand that they're there, but you also need to have a good sense of what the intent is. So that's why I gave you the first column, because a lot of times we don't talk about that, but because we only link those to, like, for example, if I was only speaking to you all and you were just educators, then I would just talk about learning objectives. If you all were just health persons, then we would just talk about more outcome objectives related to the things we did. But because this is a mixed group, and because y'all do community work, which by definition is very diverse, then it's important to understand that you adjust what you're looking for, you adjust your goals and your objectives based upon the coalition you have. So you may have a coalition of social service people, behavioral health people, and physical health people. And so that means that whatever the program or service you're doing is going to reflect that as well. So please keep that in mind. Diversity, in this one. And it's important to look at diversity also from the bigger, more modern or concurrent way we're talking about it as well, has to do with equity. Not just, not just equality, but equity, because adjustments to the population that you're serving are going to be very critical. So that's going to be important. So let's talk about a couple of things here. Now, as a program, this is a bit of a review from the program planning. So from program planning, you got to be realistic about what it is you're trying to do. And realistic asks the really tough questions. You as a leader are need to ask this question. So as we've said before, not every program initially, or not every service, or not every effort can be evaluated in a general sense. It's sometimes you have to go back and first ask, can it be evaluated? And if you really need to do that, how do we make adjustments for that? So first of all, can it be realized and can it be done in the time frame you have? So if you only have a year to assess something, you know, what is it? What should that look like, right? From start to finish. So if it's a brand new program, that's a very vexing situation because you've not had time to test anything out yet. All you know is based on your own experience, your knowledge, your skills, what you know, the what's approved, how you think this should work. And so taking a step back and say, can we realize this? What kind of work should we do? So that means you may have to make decisions about the type of objectives and eventually the type of assessment you're going to do. So is it realistically, can you achieve it in that time frame? Can you do ultimate, you know, or impact objectives, or do you need to do these intermittent type of assessments? So realistically, can it be achieved? What does the program, does it have what it needs to get it done? So again, resources are not just the financial elements of this. They're also the personnel. People you need to, are people trained, right? Does the environment itself lend itself that you can assess and gather information the way you need to gather information to be able to make good judgments about what you need to do? And all those things. And so these are the kind of things leadership wise on that. Do you have the support in general from the population you're serving to gather the information you need to make decisions about the program going forward? Those are all resources that you need. And is it consistent with your own policies and procedures? Which is another way of saying, does it align well with your vision, your mission, you know, and your philosophy, you know, as well as how you really carry those out? Because your policies in programs and procedures are a reflection of decisions you have already made about how you want to carry out what it is you carry out. And so those are what the reflections are. And so that means that whatever you're going to decide to assess, does it align well with those as well? And that's really critical. You have an ethical question that you have to decide upon in terms of your evaluation as well. For example, if you have a program or a service and that you have a very needy population, and your really core question is, are we really making the change in this population that we want? And one of the more scientific ways of doing this, of course, is comparing, you know, those that receive the service to those that do not. And that will tell you right off the bat if there's a difference. Well, a lot of times in community work, we don't have that option because we are very committed to making sure that every possible person who's eligible to receive what it is that we're carrying out either in our program or our service should get that service. So that means you have to think about how to restructure your what you're doing in a way to ask questions that allow for you still to make that distinguishing between you know, whether or not people are benefiting or not, at the same time making sure that everyone that you would like to get the service can get that. So that has a lot to do with making sure that you ask the right questions, which means what's called, as I said before, not type 3 error, which is asking the wrong question, but also you're asking and you're assessing elements of the program that will tell you where things are out. So that means instead of having a comparison type of situation, what you're doing is you're not comparing person's participation, you're observing outcomes, you know, based on what they have. So getting a really good intake, getting a really good idea of who's in the program, and then what it is that what they need and what it is that you're trying to give them, and then make an assessment of whether or not that's there or not. That is a very common practice that you work with whoever is doing the evaluation to focus on then. And it's all very doable, and it allows you then to do that. It's not as rigorous, you know, as your traditional, group who received, group who did not receive. However, it still gives you very good information that allows you to meet your intent for that. Now, if you have the option and you can do that, you know, assess persons who participate in your program and who don't, yeah, definitely go for that, because that will give you a better sense. But however, we work in community settings where that is not an option for us. So we have to think of alternative ways to do that. And there are alternative ways And that's when you work with an assessment person who can help you to figure that out. And then the last big question to ask is the cultural characteristics of the priority group. What and that covers the whole range. We mean cultural and diversity as broad as you can define it, because that's kind of how people are. People come in multiple ways. They may not, there is no single cultural characteristic of a person. Everybody has multiple cultural characteristics, cultural diversity characteristics. And so you have to keep that in mind. And that's one of the more challenging, in a pleasant way, actually, for us who do community work, is that we do not work with just sort of monosyllabic kind of people. We work with people that are nuanced in multiple ways. And that when we think about what we need to work with them for, do services with, we have to think of that. So keep that in mind, because that is always going to be the vexing part. Now, I say that because I want to add one caveat to this. The persons who may be funding your work or supporting your work may not have that same understanding that you have about the diverse cultural characteristics of your population. So it's going to be important, not only in how you write it up, but your planning, that you make that clear, and that your assessment, that you make that clear. So the education thing that we talked about when we talked about planning, the need to educate others, who may be stakeholders who may not have the same understanding of what it is and who you're serving, whatever. It's critically important that you continue to do that throughout your process, and that includes your monitoring evaluation process as well. All right, so let's just kind of give you a brief examples of the key types of objectives that I've gone over, so that we will do this. And I won't spend a lot of time on this, but I just want to give you an idea. So the process objectives that I mentioned before really answers the question, what is done and how can it be accomplished? And it really describes the interactions, the activities, and the work you're doing. We talked about impact, which is your long-term implications of your program or your service. And so what you're really describing in terms of the long-term objectives are going to be the impact on whoever it is, your stakeholders in long-term. And then the outcomes are more your intermittent groups, like, for example, knowledge, attitudes, behaviors, and so forth. And the degree to which change is expected. So those are like your short-term change, and cumulatively outcome objectives or become part of your impact objectives. And we'll talk about that in a second. So now when you put up our verbs together, and I'll show you this when we do the SMART objective table, but what you want to be able to do is you want to write objectives in a sense that, so a common phrase that we use all the time when we put an assessment section together in a proposal is that here's the goal or the aim, and we will say, and you state that, and then you period, and then you'll say how we plan to accomplish this goal or aim will be through execution of the following objectives. And then that's where you then step off into the work you're going to do. And so that's why you have to have active words and use of strong verbs. So action verbs, for example, make it patently clear to whomever is reading what it is that you're doing, or whomever you're speaking to, the intent. And I want to emphasize that word, the intent of what you are planning to do. And it's to you as a leader, it's to the people that you're working with who are your team, it's the others. So words like we plan to, we will write, we will execute, we will assemble, we compare, we will investigate, and so forth are all critical, because they are plain language words that are action oriented or actionable, and then they communicate that it is you want to do. And so you want to be able to do that. And they're also very discreet, right? They're discreet in the sense that, there's generally not another meaning to what it is you're trying to do. They are very similar, and they're also very clear, and they're very precise, and people generally understand them. So, which is why you don't want to use words that are sort of generalizable words, generalities. And generalities, I would say that we shouldn't use them, but you see them all the time. And that's because sometimes that's the way people communicate, is they communicate in generalities. And you always ask yourself, so what do you mean by that? Right? So when you're putting together objectives, the questions you don't want people to ask you is, what do you mean by that? You want them to say, oh, okay, I understand what it is you're trying to do. So this goes back to early last spring, we talked about grant writing, right? And in last fall, when we talked about planning, using simple, plain language, precise words is what you want to do. So generalities like we want to know, we want to understand, we want to enjoy, so on and so forth. Yeah, you kind of get a general idea what that means, but it really doesn't tell you that. And so it also is not measurable. You know, it's how do you measure understanding? That means now you have to define what you mean by understanding. You measure joy. You got to understand what you define what you mean by that. That's perfectly up to you as a leader and people put your decision. I strongly recommend that you if you're going to put those words in there, you also put side by side what you mean by that. So if you say you want to know something, what does want to know mean, right? So that means that you avoid, just having them stand alone, right? So you want to know how something is produced. You want to know how something is conducted and so forth. Those are more precise ways of looking at this. The other kind of thing that I see all the time, and I really recommend people, pay attention to, is to use compound phrases or words. Again, be very discreet, like in the action verb category, but don't do this. For example, compound, what I mean by that, I mean things like and or that sort of thing. Like we're going to do this and that, or this or that. Okay, you do not write objectives or discrete. So you either going to do this and then say what this is, or you're going to do, you don't, there's no and to it, there's no or to it, because you want to be precise. And the reason why you want to because you want to measure that. So you could do that with a goal, because a goal, as I said before, does not necessarily need to be as measurable. Okay, however, an objective really needs to be. And so what do we mean by that? Let me kind of give you a SMART objective, and you should be able to see this. So this table is in your handout and in your slides, and you all probably have seen this in one shape or form or another. But this is the one that we modified because we want you to get a sense of this. So this is the thing, whenever you think of objective, think of the word SMART. And this is used across the board. This is used in marketing, this is used in health, this is used in behavioral, social sciences, this is used in all kinds of economics and so on and so forth. So no matter where you go, SMART objectives are critical. But what do you always mean by that? And it's the simple definition: specific, measurable, achievable, realistic, and time limited and or time bound, depending on what it is that what discipline you're in. And so the other objectives that are used are in the third column in terms of what an S means, M, and so forth and so forth. But that's the important one is the last column. And the last column gives you a sense of what it is we're talking about. So is it description of a specific behavior there? So discrete. Is it reliable in terms of that? But also, is it measurable in a way that says, here's what we have? So does everyone share the same meaning when you say we're going to measure age, for example, or knowledge, for example, or achievement, for example? Is that really clear? Is that measurable? And is that who we define that? Now you can measure it based upon a single variable or measure or a scale, like we talked about a little bit earlier, where a scale, will give you a sense of knowledge or sense of skills gained and so on and so forth. So this goes back, I think, a question Ms. Park asked, how do you make that decision? Well, you make that decision based upon what you're trying to measure. So, and then the other bit, which is really critical here, because this goes back to what we said about vision and mission and philosophy, is it reasonable? And is it appropriate for what you're trying to do? Now, you have to make a decision. I'll give you a vexing example. So what if a lot of times it's important to understand or to measure age. Now, you can measure age multiple ways. You can have people write down their age numerically. You can have them write down their age metaphorically, like middle age, older, things like that, whatever. Now, the appropriateness of how you ask people to define age has everything to do with the purpose of why you're asking them that, right? So numeric age or chronological age may be relevant because it's a service, and a service is linked to eligibility, and you need to have people within a certain age range to do that. But it also may be linked to a program, right? Or like an education effort. And the education effort itself is going to be how people define themselves and their age, where age itself could be, said as middle age or older or younger. And that will be relevant to the education effort that you might have, or some other situation there. So age in and of itself, as a variable example, has a lot to do with your intent. So whatever you're measuring, this is what this means. Achievable and appropriate means, is it relevant to what it is you're trying to get at, right? And then relevant, of course, has to do with what it is that you're doing. And so this is why we have relevant in terms of the variables that are there. And then, of course, time limited. So how long it's going to take you to do that? If it's a 1-year program, because it's linked to the funding you're going to have, it's a quarterly, that sort of thing. So your objective, the way you write it, is going to have all these elements to it. So that's why we said that your objective in and of itself is really communicating to you, to your team, to those you work with, what it is that you're really trying to do. So let's just kind of give you some ideas on this one. And I'm going to go through this a little quicker because some of this you already know, but I just want to clarify a few things. So the specificity of objective has to do with clarifying what the focus is, what it is you're trying to do. The reason why this is important is because a lot of times you don't have it's not there. Your focus needs to be consistent with the goals and the aims, and sometimes it's not, because sometimes it's simply a task which just says we want to do A, B, or C, as opposed to what we intend for our work to help and support this group in this way. And then you talk about what you're going to do, how you're going to do it, when you're going to do it, and so forth. So it answers all the question about what's involved, what you're going to accomplish, location, and so forth. And of course, I'm going to give you a working example of all of these things. The other part of objective is going to be strategic, on this part. Now, the measurability part of that, it means that it answers a very simple question: how much, how many, and how will I know when it's accomplished? Now, how much and how many are quantitative. How will I know when it's accomplished is qualitative. So the misnomer is that a objective cannot be qualitative. The answer is yes, it can. But most of what we do are quantitative, the how much, how many, but a lot of times, because we work in community settings and community situations, perception of accomplishment, like perception of a goal, is also very important. And you do need to be able to measure that. And you measure it roughly the same way you do any kind of quantitative assessment, which is you look for keywords, key phrases, and so forth. And the other part of that is operationalize your term, which is extremely critical, because if we want to say to know, what does that mean? So we define to know as whatever it is you want to define it. That means you're making it operational. That means you're making it measurable. So if we want to say, our intent for this population is to know whatever, then operationalizing the word to know is that you want to know, do you know, or do I know, kind of thing. And so measurement, it allows you to make it tangible. It makes you to be obtainable, because otherwise it's vague and it's general, and you really don't have a sense of what it is you're getting at. And neither do people looking in on what it is you're trying to do. The other part, of course, very simple. Ask yourself, can I get this? Given that we live in this very, very vexing time, political, social climate, and resources, what it is we're trying to achieve, is it very doable? Now, some things are services that in and of themselves, a lot of people don't understand, right? I mean, we have services where we're helping people to achieve what they're doing, like some of their work around, self-compassion. That's a term that has to take a little bit of time to explain to people. It's very critical once you get it and once you know what it is, but it does take some time to explain that. And also, given how in the times we have when we're dealing with things like financial challenges and other things, and we're also dealing with a very polarized way of looking at the world kind of deal, and and focusing on something like that, which is very critical. What does that mean? How do you get there? And then when you get there, how do you know? And how do you know? And so forth. So it becomes really important that what it is you're trying to achieve, or that is it obtainable given the realities of the program itself and the climate in which you're trying to get the program to work, right? So if you are providing, self-compassion services or you're providing social support services, to people who are homeless, for example, who have families, for example, what is doable, for that group? Do the basics of just making sure that they feel good about themselves, or that they have the food that they need and the shelter that they need, or do you want to go beyond that? And if you want to go beyond that, is that achievable given the realities of the situation you have? So it is a judgment call on your part, and your program's part, your leadership part, of what is the reasonable amount of effort you need to implement what it is you're trying to achieve. And so measuring that in the objectives becomes important. So take the time to have that conversation, and then move on to, is it realistic, right? And again, realism has to do with, can it be achieved and accomplished? That's a big question, but also in the time frame that you want to be able to do that. Is it realistic to get people to change the way they look at themselves in the time frame that you have to work with them? You may need more than just a month, 3 months. You may need more than just other things. And are the right people there to help them through that journey to get there? We want to get people to be to no longer be dependent upon food services programs and those things. What does that have to accomplish? Well, that means that you want to keep the food services programs there, but you also want to have, coupled with those, like what we have in this community, is that you have food services programs, but at the same time you also are working with folks on job skill training and other things that will also help them to raise their quality of life. So those are the kinds of things to think about. So what's realistic? So one program is complementary to the other, and realistically, it is something that you have. These are all actionable things, all great things. These are all things that we do because we know that, the whole idea of working with folks, is so critically important, but we also know that it's not as simple as saying we're going to provide a service and that service itself is going to do everything. That's not going to work. We also need to look at the bigger picture and how they link together. So realism in your objective, depending on what you're trying to do, is going to be important. And is that objective a standalone, or is it one that needs to be coupled with others to accomplish what eventually your goal is? Which is, again, why I recommend, if you're considering a goal, that you have more than one objective linked to that goal, because you're going to need it, but no more than 3. All right, and then time frame. We talked about that, but your big question that I want you to ask on time frame is, will competing demands impede the completion of that objective? Do you have that? You all do not work in silos. You work in multiple places. You work with other groups, and so that means that you have other tasks, other programs, other work that's being done. And so those are all have demands on the time and the effort, and they may also be reliant on what it is you're trying to accomplish. So keep that in mind when you pull this together, and you'll have. Now, as I promised before, and so I'm going to have that. But for save your questions, you have those. So let me kind of give you some examples what I'm talking about. So the outcome can be achieved or will be changed is the action or behavior. So the key words here in terms of that is the behavior you want to change. So the apply, the build, compare, and so forth. The conditions under which the outcome can be observed, you know, is give you example of terminology you could use. So upon completion of the exercise class, a result of participation, those are the conditions. That the outcome you want to achieve is a standard test. The criteria you want to use is that you want to have some means by which you could know if the change occurred. So based on the baseline, let's say your baseline is 0 and you want to go to that, you would say by 10% over, you want to change something to be 10% over baseline. You want to give out 300 pamphlets, you want to conduct 400 classes, so on and so forth. All right. And then the priority is who the population is or who will be the recipient, of the change or participant in the change itself, like 1,000 teachers, 25% of employees, and so forth. Right. So that's the language, the first part here. So what does that really look like? Put piece together. Now, this is something that you may or may not have seen when you get objective change, but it's in the 8 steps book that I gave you. So the way that you look at this is you first of all look at what the outcome is that you want to achieve. Who's the population? What are the conditions? What is the criteria you want to use? And then you have pretty much a well-written objective. And it remind you to use measurable terms for that. So, for example, who's going to do what, when, and to what extent? This is the way that and the CDC has a handbook on evaluation, and this is the terms that they use. So some objectives works better than others. It's your decision on how you would work these and how you pull these together. So here's a couple of things that I want you to think about and answer this one if you can. So here's the example. You have example of an objective, and the objective said, when asked on a telephone, 1 out of 3 viewers of the Hearts special television show will be able to explain the 4 principles of cardiovascular conditioning. So, take a moment and answer these questions about this objective. What level objective is this based on what we've covered already? What kind of outcome are we talking about? Who is the target population? What is the conditions under which the objective will be done? And then what is the criterion for how much it will be done? So I'll give you a couple moments, I should say. Okay, so I'm going to see who's brave enough to try to address the first question we have. What is the level objective is this? Anybody?
I say outcome.
Okay. Anybody else?
I'm going to step out there and say learning.
Okay, good. All right, anybody else?
I put impact. And my question is, obviously, you probably can have more than one, maybe?
That is correct. Yes, you could have more than one. So everybody who spoke up, you're not wrong. It's just that you could have more than one. And why can you have more than one? That is really what the question is. Anybody?
Well, because it tells the who, the target, and then it tells what the outcome should be when able to explain the principles. Yeah,
Uh-huh.
so that's two.
Okay. And what else? Someone was going to speak up. I'm sorry.
I was gonna say, like, maybe I did it wrong, but I thought that we were labeling which part of the SMART, but maybe I was looking at it wrong. So were we looking at the elements of an objective for that one?
Yeah.
Not-
So let me just go back a couple.
SM,
Let me go back a
ART?
couple and I'll show you what I mean. Because you all are don't, you know, just. Okay, so what we're saying is that the SMART objectives are here, Ms. Park, as you remember, we went back, we talked about type of objectives. So this is the type of objective slide here. And
Okay,
so,
okay.
you know, yeah, and so your colleagues were saying which one they thought it was, right? So that's what we mean by
Yeah, I
type.
see. Okay.
I'm sorry?
Yeah, I see now. I see the levels there. I'm sorry.
Okay, right,
Yeah,
all right. So
okay.
what, okay, so, yeah, so let me see if did I go too far on this? Yeah. All right. Yeah, let me, sorry about that. I think I went way too far way back. Hang on. All right, yeah. So level of objective, what is this level of objective? So, and then the outcome, what is the outcome here that we're discussing?
That they
Knowledge,
would be able to explain the principles of cardiovascular conditioning. Is
Okay,
that what we're-
yes. And so the outcome is that they will say that again?
That they would be able to explain the four principles of cardiovascular conditioning.
Okay, all right. And then who will be able to do that?
the people watching the show.
Okay, all right, the viewers. Okay, all right. On that one. And then what is the condition that we're talking about here? Remember, just to give you a
Remember the
reminder,
phone?
under complete, yeah, I'm sorry, this is the condition, remember here.
So while watching the show or after watching the show.
Right. So that means that those who participated as viewers, okay? Anyone else?
Because when it asked when there, I put when asked over the phone, but you're saying that the when is when they're watching the show.
Oh, I see what you're saying, Wes.
Is that, I mean, I'm just asking.
Yeah, okay. So, yeah, okay, I'll answer that in a second. Let's see if someone else has a slightly different perspective or on that. Anybody? Okay, so the when, you're not off on this. The when is of course, the time that you're gonna do the assessment, right? So when is that? When would you do the assessment? When would you collect the information or know about what you're trying to get at? The how much part?
I guess you would say that you were going to do it afterwards. So you'd do it like retrospectively. Once they've viewed, then you analyze if they know.
Yes, the when. So so you're conducting, as you all have adequately said, just, you know, that you're asking them over the phone. So you ask them over the phone, and after the end of the television show. So the television show is over. And this is when you get, you know, you all have done this where you participated in something and then you've gotten a follow-up survey kind of deal, right? So that's the win. The win is that it's over. Now you want to know what it is that can people accomplish what they said? So the how much of this is that so your objective is your intent, right? So the intent here is to assure how many people, to assure that 1 of 3 viewers that are surveyed will be able to do the explanation, right? So that's the way you're writing the objective. So the program, the little case here is that what you're saying is that your objective is that you will be able to assure whomever it is who funding you for this television show that 1 of 3 persons, viewing these will be able to explain the information that you presented, right? And the information presented are the 4 principles of cardiovascular conditioning. Does that make sense to y'all?
Yes.
Any questions?
So this is kind of built on the fact that it would be, am I getting into the weeds to say 1 out of 3 viewers who answer the survey? Because you are going to have people who don't answer. So where does that fit?
Yeah, so that's a good question, because what you're assuming is that 1 out of 3 people who answered the phone and agreed to answer the questions, you're asking them by phone, right? So that's one part of it. The other part, though, is that are you trying to get at everybody who actually viewed? So in other words, you're taking a step back to just establishing, the actual number of people who viewed. So say, for example, you presented this to an audience, and in the audience itself, there was 100 people in the audience, and you got contact information from all 100. And then your assistant or your person goes and calls up those 100 people, right? So your expectation is that of that 100 people, 1 out of 3 or a third of that 100 you call will be able to identify this, or of the people who actually answered the questions, on that. So you have to kind of make sure that you're clear for intent. So Ms. Barlow, your question is good. First of all, you have to say intent. Are we talking about everybody who participated? Are we talking about just those that answered the phone? And so forth. You have to make that decision. This is where your judgment call also have to be in there. The more precise thing to say is that everyone who participated, a third of those will be able to answer the questions. That's all your target is a third. All right. But how you define that third, operation define that third is a critical piece. But that's going to be based upon your previous work, what you've done, and so forth. Does that make sense, or do you need, or is that still not clear? Anybody?
Okay, so are you saying that the criteria, or sorry, my dog's barking in the background,
okay,
or how much is like the 1 out of 3 viewers, but it's not just over the phone, it's like everybody? Maybe I'm missing something.
Yeah, no, so so you have to define beforehand, what your expectation is of this one. So if it's 100 people who viewed the show, are you trying to get at all 100 of them, or only or percentage of those that actually were willing to follow up with you afterwards? That's your decision. What I'm saying is your decision as an assessment person, because you're going to have to figure out, as you explain this to whomever you're going to explain it to, the rigor of it, right? So we do this. So that means that you have to really think about it. What would I do? My recommendation would be, you're going to be able to have a caveat that everyone who agrees to answer the questions, that's the target audience. That's who you're going to target. It's not necessarily everybody who attended, but everybody who agreed to answer the questions. So they will be able to explain what it is you have, because you are assuming that they paid attention. So those are the ones that gain the knowledge. And this happens all the time. Think about health fairs, right? Think about audience participation stuff, right? We all know that there's going to be a certain percentage grade of people who attend who were not paying attention, who are not going to be willing to participate. So you might want to modify the language to say those who were willing to answer would do that. I'm sorry, somebody was saying something? Okay, does that answer that for you, Ms. Barlow, Ms. Park?
Yes.
Okay. All right. Anybody else would want to on this exercise? All right. So let's try.
So it's helpful.
I'm sorry.
Maybe to do another one. I was saying this is very helpful to like put it in practice.
All right. So let's try again. Let's try again. All right. So during the next 6 months, 300 community residents will participate in one of the health department's health promotion activities. So again, what is the level of the objective itself? Anybody?
The process?
Go ahead. I'm sorry. Say that again.
Is process.
Okay. All right. So 300 people over the next 6 months. Good. All right. Outcome. What is the outcome of the what? What is the outcome you're trying to assess?
Behavioral.
Right. It's behavioral, but what type of behavior?
Good question.
Just participating? Well, not just participating, but participatory?
Yeah, participating in the program. Right, exactly. Then who's the target population then?
The community residents.
Right. Okay, now go back to this. So community residents, is it, and so in anticipation of the question, the community residents themselves, or are they any community residents or the ones that are targeted or they randomly selected and so on and so forth? I bring that up because you all will have to answer that question. You have to make a decision for that. If you were trying to assess this, you'd have to say, whether or not this is a random set of community residents, whether it's anybody who walks in the door, community resident, and so forth. Just to keep that in mind, just a point. That's your target. And then what is the condition under which you're looking at here?
When the health promotions are held, right. When? Oh, 6 months.
Yeah, no, that's a time frame. Yeah, over 6 months. Your colleague who said process was right, but what is the condition? Go back to your slide on that. What condition are we observing here? You were right, Ms. Barlow, to start off with participation in one of the health programs. So they're the health department promotion activities, right? That is the condition, the health promotion activities. That's what you're looking at. And you're looking at participation, that's what your target is going to be. And then criteria is going to be how much did they participate. So for example, you have 300 residents and there's a whole host of programs, activities, you're doing a head count of how many times of these 300, how many of these participated over that 6 month period. So that's what the process is going to be. I know it's a little thing, but you all do this all the time, right? You all look at stuff like this all the time.
I have a question.
Okay.
So 300 residents, is there I won't say advantage or disadvantage, but when do you use percentage of the population versus an actual number, or does it really matter? You just, if you have 5,000 people in the community, when would I say 30% versus 300 or right?
300, yeah.
Right.
So that goes back to what we were talking about when we talked about, how is that linked to the intent of the work you're trying to do, right? So you impact. So what you're trying to assess is the actual thing. So if you want to see the level, it depends on the level of change where you're actually moving the needle, then it really does make a difference, on that. And a lot of times the number itself may be irrelevant because it's just not that many. For example, people participating in a chronic disease who have chronic disease, generally you don't have a huge number of those persons per se, as opposed to those who participate in acute disease, training stuff like, type 2 diabetes kind of work as opposed to people with type 1 diabetes, right? So the decision on whether or not you use numbers, or percentages is relevant only to you and your program based upon what you're trying to accomplish, right? So really, in the short term, it doesn't matter. In the long term, if you're trying to hit targets for the program to show how much of a change, then you may not have absolute numbers. You may need to go back and use percentages, okay, for like that. So short term, yeah, the numbers are important. The long term, generally, it is going to be some assessment based upon percentage of the program, right? So if it's a type 2 prevention program, that's a 5-year program. The number of persons served is one thing, but of that person served, what is the percentage, either number or percent, actually demonstrated the type of outcomes you want them to demonstrate? Change in behavior, change in things like eating and attitudes, things like that. Also physiological changes, so on and so forth. So you have to make the decision, in other words, on this one. And sometimes it doesn't matter, other times it does. But really depends on what you all as a program deciding, what you all working on the assessment decide. It's a good question because we get asked that all the time, but that is kind of the way you look at it. And so in the 8 Steps book, by the way, we cover this question as well, if you want to take a look. Okay, others. All right, then. So this exercise, very similar. Think about it that way. All right, then. So those are the exercises I wanted to kind of leave you with, but I have general questions about what we covered around mission, goals, and objectives, and some of that work. Do we have general questions or other things you want to cover at the end of this section here? Take a moment. All right, so I don't see anything in the chat, and I'm not hearing anybody. So, all right then. So let's go then. To the next, our last part for today. And here it goes back to what, good question. You all are very anticipatory in types of question you have. So let's just talk about briefly, this is not going to be a long one, sections, deciding on what to measure or to observe. So measurement, so that we're very clear and we're using the same terms, is something that you have to consider. So reason why, many times, it's really important to just understand why do we measure in the first place. And so if you don't measure results, you can't tell whether or not there was success, from failure, or whether you can't recognize failure, you can't correct it. And also if you can't see success, you can't learn from it. So this is a saying that we use a lot, because one of the things that we do in communities is that we know that we're constantly learning. We don't know everything. And we're constantly learning, and we're constantly trying to adjust accordingly so that the outcomes we're trying to achieve are much more realistic and much more based upon facts and in our lived experience and so forth. So this is a saying that many of us really swear by, because you have to measure results in order to know how to do that. So measurement is very critical. So deciding on what to measure or observe, there's different ways of looking at this. So let's just start with the 365 feet view. Contextual characteristics. What do we mean by that? So we requires attention to the setting or the context. For example, the social, political, the cultural, or the physical environment where a program operates. So if you have a program say a needle exchange program, and you have done all the work, you've gotten supported to do the work, and you want to implement this in a you know, in a context that where there's the social political pushback, you know, on a program like that, while you know the benefits of it and the people participating in the benefits of it, the social political context may push back that your program may not be able to be executed, or it may face a lot of obstacles. So the question becomes, measurement wise, what is it you're trying to measure, you know, and then can you set up or measure and observe what it is you do? So you have to consider that no program or no intervention takes place, you know, acontextually. There's always going to be some contextual considerations you have to do, be they social political, be they cultural, or even be they physical. And so it is important when you're thinking about what to measure is contextual, and we'll talk about that. Now, the other part is consider the people who, you know, that you're trying to measure. This is all in your 8 steps book, by the way. Participant characteristics, and these are just some of them. These are not an exhaustive list. But I want to point to a couple of things here that I think are important. The language is important because a lot of times because we set up programs, we don't always consider that there might be multiple languages that people speak, and multiple languages that people read, multiple languages that people understand. And language is all those things, but also language may be also include not just sort of you know, verbal languages, you know, like foreign language, that sort of thing, but also may be things like shorthand. They also may be things like slang, adaptation, and so forth. So, and also just the way people interpret language is critical. So, you know, linguistic competency, which is what we're talking about here, is very, very critical, because you have to pay attention. These are things you pay attention to because they define the target population that you have. How people understand language and interpret language and use language is very, very critical to the work you're trying to get done, because it may have different meanings for that, right? We have programs, you know, where we are dealing with some very tricky and some very challenging situations. You know, like women's health issues, a lot of times fall into this, you know, in terms of how things are defined, how things are interpreted. So it's very critical for that. The other part here that I want to point out bullet wise is also background and experience. You know, your ability to carry out the work that you do, particularly to measure the work you do and how people respond to what you do has a lot to do with their lived experience. And, you know, just like paying attention to the context in which you're trying to carry the work out, you also need to pay attention to the lived experience that persons have. And if you're trying to measure that, you really should have some kind of baseline understanding of that as well. So if you're looking at behavior as it relates to, say, participating in a health program or particularly a mental health program, then people's responses or people's participation, you know, they may be dependent upon their experience, not so much as to what you're doing, but also the experience in and of itself. You know, and I think I've shared with you all some work that we had done not too long ago, where we were working with a program who had responded, you know, to the communities. You know, they went to community meetings, and a lot of the folks in the community expressed the need for a clinic, you know, to be set up in their community because they had to travel really far, and or the community clinics they went to, they felt wasn't culturally accessible and so forth. So community leaders went and got the resources, put together a clinic, put it in the community that was requested, and set up a way to assess it and so forth, or to look at it. And people did not use the clinic. They did not use the services, and people weren't using it, even though there was an outcry for it and things like that. And they were baffled. What was the reason for it? So then the focus went from an access assessment, access the service, to like what is the reason, the perception assessment of this. And when we did the perception assessment, they found out that while yes, people felt they needed the program to be there, they also on the other hand perceived the effort, to be something where it was not as good as what they had experienced or had, even to the one that they said need to be replaced. So that means that the program people had to make the decision on how to make adjustments to raise the status and the profile of the program, of the clinical services. And this is not because they weren't needed. People were definitely needing to help. They just weren't utilizing them because they perceived them not to be as good or as qualified and so forth. So that's a real dilemma. And when we came in and we start looking at asking the questions, we realized we were asking the wrong questions. We were asking about access when we really should be asking about perception, the other part of access, which is how people perceive services for versus of utilization. And that sort of overlapped into social cultural and diversity types of things as well. So when you're deciding to measure something, make sure that you're paying attention to questions or things to measure that goes back to what we said before, that are relevant, and attainable based upon what you're trying to get at. That means that you have to really go back and do some kind of baseline review and some kind of pre-review or some kind of understanding based on your own experiences. Whatever way you get there, the reality is that you really do need to understand the situation. Now, we talked about persons, but also could be situations, physically. Changing social and cultural and political climates will also affect your ability to measure and do what it is you need to do. Now, program implementation is very, very similar in a sense that you're measuring how well a program is being carried out. And there's a whole host of things to pay attention to. The principles, of activities. What are the services and activities that are being carried out? What are the tasks being carried out? What are the actual services themselves? How they're being carried out, processes wise, what's there? What are the personnel? Are they well trained? Are they sensitive? Do they have the temperament? All the things that you need to carry out good services from a staffing perspective. Are the resources there? Not just the resources, the basic stuff you need to do it, but the other bits that you as leaders know all the time, which are the serendipitous things that you need to occur to come up, like something you didn't plan for. Can you nimbly make that happen, right? You may be a program in a certain area and you may plan for people who speak a certain language, but you may find that there are people who speak a certain language, but then there are those that speak, that has that nuance of that language, right? Speaking Spanish in general is good, but there are sort of dialects that also are there. Speaking languages from people of African descent are there, or South Asian descent are there, but there may be dialects that in and of itself, may be there. We ran into this many times when we were dealing with some of the disease programs we had, where we had people who spoke several South Asian language, but then we ran into a Hmong population that had its own language. And we had those that were in the flatland language and in mountain language. So things like that occurs. And so the question becomes, in terms of measuring your program, paying attention to that. And then of course, administrative arrangements. Overall, what we're saying here in terms of implementation is that you're paying attention to things like cost benefits, what works and what doesn't work, other types of things. And it's program implementation or implementation evaluation in and of itself is a very complex thing. The bottom line, though, for you all who are in leadership is you're asking the question, you're trying to assess the question of, are we doing the basics? And it's not just a cross-sectional or outcome oriented. It has to be process and impact, because what you're trying to get at is that a program itself, if it's going to be maintained, if it's going to be able to carry out and make the difference or move the needle, you're going to have to look at it over time. You can't just look at a program at a single point and say, this is it. You could do that if you need to do a cross-sectional or outcome assessment, but in order for to know if the program is actually making the difference you're trying to get at, you're going to have to look at it over time. And so all these other things are very, very critical there. And let's see. So that means paying attention to outcomes, and outcomes are assessed, as we said before, both in the short and the long run. And you also then pay attention to that. So outcomes themselves are not just positive. They could be negative outcomes. They could be things you didn't anticipate, right? And so you should be able to assess those and then make good decisions about those. That should be short and long term. And, you know, the other part of it is they need to be, you know, part of what it is that you have agreed to be your funder, be your population, and be your other stakeholders as well. And like I said before, I pay attention to both asset and resources as well as program costs, which is part of your implementation assessment. So yeah, I mean, I didn't have a huge amount on that part because I think that those are pretty much tied in, but I want to see if you have any questions or concerns or anything at this point related to what we just covered. Anybody? Okay, so I will start one section because I think it's very relevant to what we just discussed. So section of indicators. We had a lot of discussion before. This is another short section, so it will not be long, about indicators. We talked about this before, and I think some of you had questions on that. So what is an indicator itself? So in research, an indicator is generally a variable, and a variable represents, you know, at some point, you know, some measurement point. So a measurement, as we said, is the function of what it is you're trying to get at. And an indicator itself measures the expectation of a program. But it's more than that. It tells you, you know, what it is you're trying to do. So you can have indicators of particular type of things you're looking at, like cognitive behavioral indicators, health indicators, social conditional indicators, and so forth. So an indicator in and of itself is what it is you're going to measure, right? That's a very simple definition. It's what it is you're going to measure. So in research, what it is you're going to measure the variable. In monitoring evaluation, it is the indicator itself. So what it does, it provides you the means by which the conditions that you're trying to get at, you know, in the program, in the system, in the condition themselves, to talk about and to say, here's what we have. Now, there's different types of indicators, of course. And these, again, are in your 8 steps. There are key indicators, which is the primary thing or the major thing you're focusing on for the overall thing you're trying to get at. So what is it trying to get at overall? That's would be a key indicator. Then based upon a key indicator, there's these things called supporting indicators. Now, what happens is that, so a key indicator is a broad thing. So say health is your indicator. Under health, there may be certain types of things you want to measure, like, you know, level of whether or not they, you know, they're overall healthy, which means you're fine across different types of ways to look at. But what if you want to look at physical health? You know, that's a supporting indicator. Behavioral health, that's another indicator. Or you may want to say that those are personal ones, but what about environmental health? In other words, then, do you live in an environment that has safe food, you know, safe water, clean air, you know, those type of things. Those are all supporting indicators. So if environmental health is your key indicator, and then what is the things under those that you're trying to look at as well, right? And so the other part of though is to think about how do you select the indicator. So let me just go back just to be clear. So to be clear, an indicator is what it is you intend to measure, independent of what it might be. You want to have the 2 main types of indicators, the key indicator, which is the thing that you really want to focus on the most, and that could be something global. And then you want to focus on supporting indicators, which can be either themselves a bit global, or they may be more precise. or discrete. All right, so let me give you some criteria about how do you select an indicator. So it should always be one that is has a high degree of simplicity. So it should be straightforward, should be well-defined, reliable, and valid. So reliable, you know what that means, you know that, and valid means valid is it should measure what it's supposed to measure. Reliable means it measures what it is supposed to measure every time you try to measure it. Well-defined, we talked about that in terms of operation defining this, that you and everyone else understands what you mean when you say this, right? And it should be pretty straightforward. It shouldn't be vague. It shouldn't be something that people are trying to figure out or to guess what it is. So that means it should be understandable and credible to anybody, to the public, to policymakers, and so forth, right? So when you say you're trying to measure people who risk of COVID, you know, what does that mean? Risk, you know, at being at risk for COVID. Well, that's, you know, in and of itself is a bit of a challenge, but risk simply means exposure, you know, to someone who is infectious, or environments, being in an environment where there are people who potentially are infected and so forth. So those are all ways and straightforward of looking at that. And those are all reliable and valid means by which you would measure that. And if your indicator is the conduct of COVID, then that's what you're kind of looking at. And it should be stable. It shouldn't be something that's now when we use COVID, you know, granted, because it's a, you know, it's a virus. It mutates and it changes over time. There are going to be things we need to learn about it, but there's certain characteristics and commonalities about it that we always will know. However, we also then need to know that there is going to be consistencies in terms of prevention. And so that's kind of where stability in this situation goes. And so there's going to be these changes and adjustments. Infectious disease is one of those challenges that, you know, you can equate levels of infection with levels of, you know, transmission, which levels of, you know, and so forth. So it's really important to look at those things. So indicators of where risk might occur, right? You know, spreading events, you know, where there are people who are potentially at high risk, you know that you're going to have high levels of infectious disease. And you know that if you take precautions, for the most part, you're going to prevent persons from getting ill or unfortunately dying from the situation itself. So COVID is a good example of stability when you're trying to look and measure, you know, indicators, particularly if you're trying to do stable estimates of indicators. The other part of it is that when you're trying to look at, decide on a criteria for selecting an indicator, your other big questions become, is it something that you can actually obtain? You know, is the data readily available to that? You know, if you're trying to get at, say, perceptions of persons related to a certain situation, that may not be obtainable information unless stuff is written down or documented. So that's why a lot of times people use, you know, quantitative indicators than qualitative indicators. Doesn't mean you cannot do that. It just, you know, you can use archival information, you can use records and other things. You just have to make sure that however you define it and however you make a decision about the information, that you know it's obtainable. So if you want to know what certain political persons thought about putting in place a certain program, a service program or something like that, then you ask yourself, where would I find that information? And is that information readily available? Is it reliable? Is it valid? Is it obtainable? And would people agree? So, and then you have to ask yourself about cost, you know, feasibility of that, and then emphasis on whether or not the data is collected and used and can be interpreted in such a way you have. So availability is critical. The other part, of course, is that, is it logical, relevant, and important? So is it important to know about health conditions, you know, and health systems that you can? So this is concept validity. So the understanding of how something works and why it works, understanding of why we have certain conditions. You know, the whole controversy we have now for example, of, persons who, had certain types of jabs from different types of inoculations, which ones are stronger than the other, which ones are better than the other. People who wear different types of masks, cloths versus in mask, and so on and so forth. Those are all important, and those are all things you can define, and all things that you can sort of have a status about and be able to measure and to say whether there's differences or not. And as we mentioned before, goals and objectives of the program. And then we have these things called sentinel and important public concerns. In other words, then, while it's important to set up a program you want people to access and use, you really want to know whether or not that's something that people see as important or not, right? And certainly we are in a very tough, social political climate, in the sense that we have these trifecta or quadfecta, if you will, of issues related to, racial and social justice, financial challenges, disease situation, economic feasibility. Those are all things that impact contextually what it is they're trying to do. So it's important that when you look at indicators, that you look at the indicators also contextually too, as well as that. So that means that they're going to be associated with any kind of change on this one, which is where the concept of predictive ability comes in. The other part, of course, is the broad representation that I mentioned before, in the sense that, or is it something that, given who you're trying to reach out to and who you're trying to work with, do they also have this one? So it's not just your small group, but the bigger community in which groups work. And so what is the norm for that? And of course, as I mentioned before, it's given what we do for a living, it's impossible for us not to have to consider the political feasibility of any indicator that we have, particularly if we're trying to get it and use it for the intent of the overall health. So whatever measure, you're going to use, or whatever it is you intend to measure, it should be well established, and it should be something that you can use. So example of these would be standards for types, for numbers, for timing, for vaccination of children, for example, well-established standards for appropriate number of visits to the ER with young persons with asthma, high to low, and so forth. All right, so that was a bit complicated, but I want to sort of just move you to thinking about this. To thinking about this. So the last thing I want you to think about here, as I said, this is a short session, so we're going to go with it, is deciding on this. So we talked about what measures are and what to measure. The indicators, or what it is you're trying to measure. So the main point of this slide, and I'll leave you with this for discussion. Excuse me. Is going to be selecting and defining the indicators that you think are relevant to the outcomes that you need and the assessment that you need. And that the other key thing is to be aware that available indicators and data may, be there, and they may not be there. So that means it's important for you to work with your teams, with your community, the people you work with, to really be very clear on what it is that the indicator is that you're trying to have and look at. And so consider that as well. So I just want to leave you with that. All right, so that was covering those three things. Any questions or points that you need to further explanation that you didn't understand and so forth?
Dr. Telfair, this is
Sure.
Thomas Bullock.
Uh-huh.
Picking up on where you just left off about the indicators, yes, I get it. But then going back to when you began about objectives, because objectives have to be measurable, do we want to identify the indicators, because that's how we're going to measure the objectives? Do we identify the objectives the indicators when we are constructing the measurable objectives.
Yeah. Short answer is absolutely yes.
Cool. Thank you.
No long answer there.
Okay. Appreciate it.
No problem. Other questions? Anything we've covered today? Okay, so I don't really see any, and I don't know, okay, so I didn't really see any questions there. So I just want to make some comments about what it is that we're going to cover next. So for you all and whole, you're going to be interacting with, next time around, we're going to start doing much more interactive. So we have the 8 steps booklet and the 8 steps book and the 8 steps worksheet. So please look at those when we meet. I think the 3rd of February, if Mr. Rachel back on, or Mr. Hubbard, your office back. Yeah, so we have 8 steps manual to look at. So the next go round, we will start and then if you please look at the manual itself and then look at the worksheet. And the worksheet is designed to do how you create, to literally to cover what was just asked, you know, about indicators and measures. And we will walk you through that. So we'll start it, and then we have another set of discussion slides and that sort of thing to do and work on that. So please, what I would like you to do, if you can, bring something with you. So if you're working, for example, on a project and that you want to take a look at your goals and objectives and so forth, please bring that with you. If you have a grant that you're putting together or an initiative you want to construct it for, or whatever, that's the only way we're going to get anything from this, is that if you all bring stuff for us to walk through, address, and work with. I'm not 100% sure if we're going to break you up into working groups or not. I got to reach out to the team and see how they want to handle that. But we definitely will be starting with the 8 steps book, and there's a couple other handouts that we've given you in that. So apologize in advance for overwhelming you with handouts, but they're all good stuff, but we'll come back to you on that. So any questions about what it is we're going to do next time for you all? Or the requests I have about you all bringing something?
Would you like for us to send anything to you in advance, or just bring it?
Yeah, I don't know. I mean, why don't you do both? And then let me decide, because sometimes it's easy.
Okay.
It works both either way. So like, if I decide, for example, to use what you've sent as a case, then we're going to use that as the case for the whole session, kind of thing, or I may switch up. So I haven't quite, I've done it different ways with different times. So let me think about it. But I would just say, if you wanted me to send me something in advance, I would love it. And then I can make a decision there. Does that answer your question, ma'am?
Yes, thank you.
Okay. All right. So let's see. There's some stuff in the chat. Yeah, the next session to answer the question is the 3rd at 10. And yes, so we'll start at 10 on the 3rd, right? Okay, any other questions about bringing something or sending something? So let me just, like I said, let me emphasize one more time. You will get the most from what we're going to do over the next couple of sessions, the last 2 sessions, if you are or have something that you want to use as a point of interaction, your own case, right? Independent of this, because you all are very diverse in what it is that you do and what you focus on and that sort of thing. We can talk about different areas, but the more diverse of the areas you talk about, I know the more you'll get from it. So please bring something that you think, even if you think it's not something that fits into the monitoring evaluation that we've talked about so far, bring it. And then we'll problem solve around how to make it such that it is, which we do. To me, that's very much the challenge and also the fun of it. So please bring something next time. Okay, any last questions? All right, so we're finishing very early today, so y'all get this hour or two back for the rest of your day. I appreciate that. This is going to be a short session. We'll have a longer session next time around, but we have a short one this time around. Okay, any questions in the interim before the next third? Please let us know, and we'll follow up with you before the February 3rd. Okay. All right. Well, thank you all. Have a good rest of your day, and we'll follow up with you then. All right. Take care.
Thank
Thank
you.
you.
Thank
you, Dr. Telfair.
All right.
Thank you.